Morning anatomy classes. It's Monday morning, March 30th, 2020. Just wanted to go over a couple basic things with you from chapter 13, just to kind of reinforce a couple of topics that I've been asking questions about, including the current assignment on viruses. Understanding how the body protects itself is kind of the centerpiece of this chapter. Obviously, the immune system, lymphatic system. What you need to do for your project, the virus project, the little short one that I did, watch that video that I posted for you. I think that'll kind of shed some light on how a virus infects a cell. There's obviously a number of other types of pathogens that affect us in different ways, but obviously with the coronavirus being the reason that I'm sitting here filming your lecture, probably be an interesting thing to understand how it's actually affecting people and how all viruses affect our cells. The ones that are pathogenic. Anyways, back to the question. We have two basic types of ways to protect ourselves. And within each of these two basic categories, there are a number of different subcategories. Your body has evolved multiple mechanisms to protect yourself from invasion by pathogenic bacteria, viruses, fungus, whatever they may be. So I want to go over this with you briefly based on some responses to the questions that I asked. I think that this is something that needs a little bit of clarification. Just as an aside, as I'm thinking about it, as far as assessments go for each of these chapters, I've had a few of you ask these questions. That's going to be a work in progress. I don't have anything specific in mind at this time as to how I'm going to do that. I will not be mailing you a hard copy of a test. Most likely it's going to come in the form of a project with some specific questions that I want you to address within that project, just to give you a little bit of space, a little bit of leeway to be creative, to explore the topic in a way that's meaningful to you, and obviously let me know at the same time that you understand the material. So that's my responsibility, and there'll obviously be some questions. This is uncharted territory for me as well. But let's talk about this topic that's behind me on this little dry erase board, specific versus non-specific defenses. When you talk about specific defenses, and I've kind of covered this a little bit with you guys already before we left, but I'll go over it with you again. There are a couple of cells in our body, white blood cells, that specifically target a pathogen. It's whatever pathogen that may be. They have evolved, they've been developed within your body to do that, typically in response to an infection or an exposure to that pathogen. Now, we are born with certain types of immunities built in, and I covered that in a couple questions as well. Those are the innate immunities. Those are ones that you're born with. The other ones come after. Those are due to exposure, induced immunity. So again, when you are exposed to a pathogen, whether that be through an infection, whether it be through a vaccination, you're going to develop some T and B lymphocytes. Now, obviously, there are a number of different types of B and T lymphocytes within your body because they have evolved, like I said, or developed to address specific pathogens, whether it be a certain type of cold, whether it be the coronavirus, whether it be anything else. So how do they differ? B lymphocytes and T lymphocytes, as I said, are specific immune responses or specific immune cells. The B lymphocytes make antibodies. They're proteins. Those proteins get released into the bloodstream, into the lymphatic system, into the lymph, and what they do is they target the membrane or the coating of the pathogen. When I say coating, that's typically what they refer to as viruses. And they either weaken that particle, that virus, or that bacterium, or they destroy it entirely. So if they weaken it, then allow some of your other non-specific immune cells, white blood cells, to kind of clean up afterwards and destroy it, knock it out. B lymphocytes, again, produce antibodies. They don't get their hands dirty, so to speak. They release these, they're within the bloodstream, whereas T lymphocytes are more of your maulers. They're going to literally get after a specific pathogen. They're going to grab onto it. They're going to destroy it. They're going to use some type of endocytosis, some type of other reaction, which they actually bring it into themselves, destroy it, break it down within the cell itself. So T lymphocytes do that. Now, the nice thing about our immune systems in most cases, I've had a number of questions asked over the years, and I'll kind of address that before I make my remarks. And why do we get sick all the time? Why do you get 3 or 4 colds a year? Because there are multiple strains of these viruses and bacteria around us. And when you get infected with one type, typically you'll have some type of immunity that remains, and that's where the memory B cells come into place. The memory cells are going to remain after the infection has passed. So after you're better, after all the symptoms and signs have disappeared, we're going to leave a few of these cells in the bloodstream. So if your sister, your brother has the same cold that you had a month ago right now, and they sneeze on you, you'll get infected again. Those viral particles will enter your body potentially if they get past the things that are on the other side of the board that I'm going to discuss here in a minute. But you already have those immune cells in place that they can multiply quickly, and before you even feel any signs or symptoms in most cases, they'll be eradicated, they'll be destroyed, and your body will be back to as good as new. You won't even know you were infected. And that's the nice thing. So throughout your lifetime, you build up these memory B cells. It's like going to a library and checking out a book, a manual on how to fight disease. So every time you get infected with something, you are going to have some cells remain in your body. So if you get infected again or you have a subsequent infection, your body will be better able to fight it off the next time around. And that's called building immunity. I'm sure you've heard that terminology before. All right. On the other side of the board, we have non-specific defenses. All right. I usually, in my notes, I think I address these first, so don't get confused when you're looking at the notes. I don't have too much written on the board here. There's a lot more information in the notes, and obviously you can always find things on the internet. But non-specific defenses are things that are meant to keep, A, the pathogen out of your body in the first place, so it doesn't even have to be encountered, or B, once it gets into the body, they're going to try to destroy it before it starts to multiply. And that's obviously when problems start, when it starts multiplying in the body. Again, watch that video that I posted yesterday. So your non-specific defenses fall into 3 categories. Barriers to entry, things that keep it out. Your skin, mucous membranes, mucus, saliva, the oil on your skin, acid in your stomach. Those are all things that are going to help prevent things from proliferating, getting into your body in the first place. Natural killer cells, large white blood cells, they are basically generalists. They're not basically generalists, they're generalists. They're going to go around the body and they're going to interact with anything that has antigens on it or markers on their membranes or coats that they're not used to, and they're going to destroy it. Can they mount an attack that is the same as your specific defenses? No, but they're good for cleaning up random things that enter the body before they start to proliferate. They also can identify cells in your body that have not divided properly and can become cancerous and destroy those as well. That's one of their other responsibilities. They destroy cancer cells too. Inflammatory response, you hear the word inflammation. Inflammation typically has a negative context to it because we think about, I have inflammation, I'm going to take anti-inflammatories like Advil or Tylenol or aspirin. Inflammation that becomes chronic and is not accompanied by any specific type of disease, obviously we want to treat that with pain medication to relieve that inflammation. But inflammation is a good thing. Inflammation is important in our body. Without an inflammatory response, you cannot respond to infection properly. So what happens in an inflammation is when the body becomes damaged or tissue becomes damaged or something enters the body and causes a disruption, you'll have an inflammatory response, which is mediated by a number of different chemicals that are going to be released by the damaged tissue. One of them that you're probably familiar with is called histamine. Histamine, when it's released, it causes the tissue to become more permeable to blood cells, specifically white blood cells. They can get in the area. That's what you want. You want to mount a response. You want to invite those white blood cells to that area, whether it be a scratch on your arm or an insect bite or anything. So once that inflammation occurs, you'll see some swelling in the area, a little bit of itching, maybe some tenderness, maybe a little bit of heat associated with it. You can actually feel it sometimes. And all that is the blood going to the area, bringing more white blood cells to fight a potential infection. And again, that's a non-specific response, and that's very important. Inflammation is very important in keeping us healthy. It's part of the immune response. So again, I hope that you guys are going to find these little mini lectures useful. Probably a few times a week, depending on the topic area. Keep an eye on Google Classroom for instruction specific. Probably by the end of the week, we'll have some sort of assessment or project. Get that virus project done. Think about the things that I just talked about in the last 10 minutes. What would keep a virus from getting to the cell and allowing it to proliferate? What are some things on this board that might happen? And I asked you, I think, for 4 coincidentally, there's basically 4 things on the board here. So think about what's going to keep that virus from getting to the cell in the first place, or a cell in your body in the first place, and starting to multiply. Have a good day.